Okay, so I just wanted to let you know that I am live through Zoom, which means that I may not be able to look at your comments directly while I am speaking during the live. So, but what I will do is I will definitely take up the comments towards the end of this session. Okay, so we have a very interesting topic today, and the topic is what grave physical illness tells us about boundaries and stability in life. So what is the how is the concept of having boundaries, and what are boundaries, by the way? How are having boundaries and stability in life associated with having grave physical illnesses? So I will take a few more moments to just check on my phone if people are online, because that is the only way by which I can check and know that people are here. Okay, I do have quite a few comments, and I will definitely have a look at them. Let me have a look at the comments. Okay. Vani says, hi Gaurav, very good evening. Jasdeep says, hello Gaurav, how are you? My love to you. Thank you so much, Jasdeep. Wahida says, hi, and people are joining in. I'm waiting for a few more people to come in and be a part of this live. And I know that all of you have waited for quite some time uh, for me to come here and speak about the different issues we take up, whether it is family constellation, whether it is about diseases, whether it is about money. So in this live, I am saying it aloud for all the people once again. In this live, um, it is about how grave physical illnesses are associated with our own ability to have boundaries or stability in life. Okay, and I'm going to take the help of a PPT for all of you to understand what it is all about. Okay, so this life is not just a live, but also like a little class, right? So I do want you all to listen to it properly and have your questions ready, whatever questions you may have, and maybe stay with me at least till 9:15, 9:20, because this is one of the topics that I have not spoken about before, and um, and you could learn a lot from this topic. Okay, so that's one thing. The other thing is, we have few upcoming workshops on specifically on physical diseases, and I'm also going to talk about that a little bit. And this is like a preliminary class before we go ahead with that. And the great news, and there's a surprising news that I will be sharing with all of you towards the end of this class. Um, but let me not reveal that to you. Okay, so let me go ahead with the topic for today. I will take a moment to share my screen, so just be there with me. Okay, so here we have the slides for this life. What grave physical illnesses teach us about boundaries and stability in life? As I move ahead and I begin to speak about it, I would like all of you to be here with me and also share this live so that more and more people can know about grave physical illnesses. It is not a myth that there are more and more people suffering from autoimmune disorders nowadays. There are more cases of fibromyalgia. There is more cases of polycystic ovarian disease or polycystic ovarian syndrome. There are more cases of chronic kidney chronic kidney disease. There are more and more cases of thyroiditis. There are more cases of Hashimoto's disease, or let's say Graves' disease. Okay, and all of these are diseases that the body uh, creates within itself. It happens um, in a way which is called autoimmune, meaning the body creates by itself. Okay, so we know that with the growing times, we have more and more people going through such autoimmune diseases or diseases that are created by the body without a communication, without an infection, without something from outside, without an infection, without an injury. So when the body creates these diseases within itself, these are called autoimmune disease. The body reacts against itself. And we know that a lot of people are going through it at this moment, currently, in the present time. Of course, people, even in the time of COVID, we have seen that people with larger um, propensity towards autoimmune disease also have um, more opening or more propensity towards drawing more infections. So there is something about autoimmune diseases which is important here in this context, also in the context of this recent pandemic as well. So I request all of you to share this live at this moment right now as it's going on, so that more and more people can ask questions and I can answer those questions. Okay, so starting with it officially, what grave physical illnesses teach us about boundaries and stability in life? So in the last few lives and in the last few talks, I have talked about how chronic illness is a result of long-standing case of post-traumatic stress. Okay, so when the body has gone through trauma for a long period of time and the body is trying to cope with that trauma, of course, somewhere the body collapses, it breaks down, it is unable to deal with the trauma. Okay, but at the same time, what exactly is trauma? So we keep talking about trauma, trauma, trauma all the time, but what exactly is trauma? Trauma is this state of overwhelm. When you are overwhelmed, you know that your brain is divided into three parts. Okay, for people who do not have you know a basic knowledge or a basic understanding of how the brain functions or what is the anatomy of the brain, we know that the brain has three parts. All of us know that it's the forebrain, the midbrain, and the hindbrain, right? We all know that. And the forebrain, the frontal part of the brain, we know um, came later in evolution. So while we have the hindbrain, which is basically the reptilian brain, okay, then we have the midbrain, which is of course the mammalian brain, and then we have the forebrain, which has this important part called the neocortex. Neo means new and cortex means tissue. So this is new tissue. So the name itself implies that this is new. This has come newly in the whole evolution. This came first and this came second and this is coming new. And this neocortex is that part of your brain which is responsible for rationalizing, analyzing, processing, putting things in pieces, and carving and weaving out a story for you to know what the present situation is. For example, right now I'm sitting in this room speaking to you people, and let's say I have a red wall behind me and I have a painting here, and then I have light, and basically my body has made sense of my environment. I know that this is the story right now for me. Okay, I know my, at the same time I know my present age, I know my name, and I also know what time of the day it is, which day it is. So my neocortex has analyzed the whole situation and has verified this story that I am present at this moment. But what happens in trauma? In trauma, this neocortex, this part of your brain, is not able to form these associations. Let's say it's a case of an accident. Let us say it's a case of severe sudden abuse. Let us say it's a case of someone suddenly uh, discovering in front of them that that two cars have collided and have gone up in flames, right? So that's a moment of overwhelm, and your neocortex cannot form the analysis and cannot form the associations. And therefore what happens, those pieces which needed to be weaved together in order to process and form the story, they scatter. And the moment there is scattering, your body and your brain disconnects from the whole environment. It disconnects from the mind. It disconnects from your spirit. And as a result of which, there is this state of overwhelm that I don't know what to do. I don't know what to do. It's too much. It's too much, because the processing is jammed, right? So you have a GIF here, which tells us it's just too much. I can't process anymore. So it's the neocortex which shuts down. And as a result of that, um, these scattered pieces remain somewhere in our body, somewhere in our unconscious, somewhere in our energy. And these are those scattered parts which constantly keeps us on our toes, because we know that something might just happen right now. The trauma can just go ahead and recur, and it might just come back again. So the body goes into the state of alarm, hypersensitivity, hyperactivity, um, hypervigilance, as well as feeling absolutely aware, awake, to the extent that um, you are in a constant state of being alert. So there is this constant alertness that is there. And that's what we usually called PTSD, post-traumatic stress. So we know that PTSD in the long run does cause the body to be in this constant state of overwhelm, as well as in this constant state of alertness, and therefore more and more stress hormones like cortisol, adrenaline are secreted, and as a result of which there is more and more inflammation, more and more wear and tear that happens within the body. But then what we also don't think about is, when we talk about trauma, we usually assume that it's a singular event that may have happened, like an accident, like as I said, two cars going up in flames, like a case of abuse, like an event which is so demanding and so large and so overwhelming that our body could not process anything about that event. But what we forget to consider as trauma is what you see here in this slide. So I'm reading out this question in yellow for you. But what is not recognized as trauma may contribute more, actually, to grave physical illness. So there is something that we are missing out here. Beyond trauma, there is something that we are missing out here, and that something is chronic stress. Okay? So here you see in this picture, in this representation, chronic stress is, let's say, driving to work. You find a lot of traffic every single day. You find traffic and you are unable to navigate through it. Secondly, you have an annoying boss and you feel the pressure and authority of this boss on a daily basis. Similarly, bad work schedule, that every day you are unable to manage your schedule because, well, one day you have a morning shift, another day you have an afternoon shift, and the next day you have a night shift. Or constantly dealing with a difficult spouse where you know that the moment you enter home, your body has to be like this because now your body is in fight mode. Similarly, poor sleep habits and, let's say, negative people around you who also do not leave you with a feel-good factor, wherein maybe you have to argue with them, maybe you have to speak every time in order to prove a point, or maybe they dominate over you. All of those come under chronic stress, and chronic stress is something which we do not include as trauma. Someone shouting at you on an everyday basis and you normalize it because that's how it works at home is chronic stress. someone dominating over you, and you having to please that person every single time, and being constantly apologetic to the person, to the authority figure, so that your point is taken and you are considered significant, is chronic stress, right? And what we forget about chronic stress is, once again, the truth that we don't know, or the truth that we forget about chronic stress is, your immune system does not exist as an isolated island. So your immune system is something that functions concurrent to your environment. So if your environment has chronic stress all the time, meaning if your environment has someone who dominates over you, if your environment has someone who makes you feel small, if your environment has, let's say, anxiety constantly looming, where every single day you have to work in order to fulfill your targets. Let's say you are working in an organization, or let's say you are working in a bank, where you have to constantly fulfill everyday targets. Or let's say you are working in an university on a project which demands everyday empirical targets that you need to reach. Your immune system is not going to sit there and exist as an independent island or an isolated island. Your immune system will function with its connection to that environment of yours, which is constantly keeping you under this pressure, constantly keeping you under this stress. And that's how stress hormones on a regular basis will be secreted, and on a regular basis there will be wear and tear in the body. On a regular basis there will be inflammation. So we know the plight of medical student. I myself have been a medical student, and because you truly have to struggle a lot, you have to study a lot, and the lifestyle that emerges as a result of uh, studying medicine is also extremely demanding. And unfortunately, in not just in India, but in many other places, this lifestyle becomes unhealthy, because you not only have to keep a check on how much you're studying, but there is this constant demand out of you to perform, to be better, to attend clinics, to be in wards, to write your history properly, to have these authority figures, your professors and your seniors looming over you to ensure how you're doing and how well you're performing. So that becomes a chronic stress. And not just that, but that stress becomes a part of your personality. So much so that later in life also, you may feel that you are under constant watch. You may feel that you cannot speak up to an authority figure. You may feel that you constantly need to outperform your fellow mates. Or you may feel that an obsession that you have not seen this patient properly, in the sense that you may not have taken the history properly, or may not have known about this case properly. So it becomes a part of your personality, and you may begin to feel that a watch, or let's say a pair of eyes, are constantly seeing over me. So you become one of these that I have listed. You can become a pleaser, which means that everything you do so that the other person is pleased, and it validates you. Or these personalities can also be a part of chronic childhood stress, where you can become a caretaker, where you're constantly taking care of other people, or other people's needs, or other people's demands. Or you may become the giver, where you feel that if I don't give, who will? So I will have to do it. I will have to give. It's similar to the caretaker. Fourthly, you may become the guilty spectator, because you feel that you are so frozen, because that's the attitude, or that's the personality that you have developed over time, that you are so frozen every time someone shouts at you, or two people quarrel, that you have to become the spectator. So even if you keep on feeling guilty about not doing anything, you still become the guilty spectator. Similarly, you may become the peacemaker, wherein you develop and imbibe a personality who is ensuring all the time that other people are in their places, other people are doing well, other people are satisfied, they are pleased, there is no trouble in their life. So you may become the peacemaker. Similarly, you may also become the swallower, who sees everything and immediately gulps and swallows and says that, okay, I'm not going to deal with it right now because I don't have the time and I have to take care of other things, so I'm just going to swallow it, right? And continue to feel like a victim. In all of these different personalities that I have described, you may continue to feel like a victim because you may not even know that there is looming pressure all over you. And mind you, the pressure may not be a human entity. The pressure, as I said, could be a target that you reach in your job, or let's say that you need to reach in your job, or let's say an empirical target in your everyday project in your university. It could even become your electricity bill. It can even become your home rent. So all of those can become your stressors and can lead to feeling constantly overwhelmed by chronic stress. So in all of these personalities, we see one thing. There is one common thing that we see in all of these personalities. And because this live and this talk is about boundaries and stability, let's move on to the next slide. What happens when we can't say no? So the thing is that in all of these personalities, we see people are unable to say no. They cannot put a boundary. They can't say that I will not do this, or I won't be doing this, or I won't participate in this, or I wouldn't choose this. They feel so overwhelmed that their boundaries are constantly pushed to the end, pushed to the wall, and they can't say no. So when we are unable to say no, right from childhood, our boundaries are compromised. And it is compromised and compromised and compromised till you become an adult. And even when you're an adult, you cannot say no to your boss. You cannot say no to your spouse. You can't say no to your friend. You can't say no when people come and ask you for unreasonable demands. And you can't put that line where you tell people that, well, this is where it ends for me. Do not cross beyond this. So what happens then? What exactly happens to the body? So when you cannot say no, your body will figure out a way to say no. Okay. So there is this Dr. Gabor Mate, who has written a very famous book called When the Body Says No. And even there, Dr. Mate describes how chronic illness like, let's say, fibromyalgia or PCOS or thyroiditis or let's say a multiple sclerosis. In fact, multiple sclerosis is very common. Then we have autoimmune, all kinds of autoimmune diseases like Sjogren's syndrome, right? All of these diseases and the people who go through it, he observed that in every one of their life, they could not have proper boundaries. They couldn't say no. They couldn't put a line and say that, well, this is where it ends, right? Probably right from childhood, there was a lot of demand, which led to, or there were a lot of responsibility, which led to development of these, as you see, these personalities. Either the person became a pleaser, or the person became a caretaker, or the person became a giver, or a guilty spectator, a peacemaker, a swallower, a victim. And because they couldn't put down a boundary for themselves, they couldn't lay down a line for themselves, therefore the body was beginning to say no. So this is where we stop. This is where it ends. And unfortunately, he observed that many people died as a result of these autoimmune illnesses because they had progressed way beyond measure. I have had, and this is one important part, that I have had many cases wherein even in relationships, let's say the husband is not able to say no to the wife and tell her that I don't want to be in this relationship, or I don't want to be physically involved with you, or I don't want to be next to you. And they continue the relationship out of guilt. And then in men, I have seen that they develop conditions like chronic prostatitis. In women, they may develop anything from, let's say, a UTI to a vaginismus. Vaginismus is when the walls of the vagina are contract so much that they become stiffened so much that it is not possible for them to be able to consummate, or it's not possible for him to have sex. So somewhere the body is preventing, and somewhere the body is saying no. And that is happening probably because these two people who have come and who don't want to be together, and the woman is trying to say that I don't want to have an intercourse with you, or the man is trying to say that I don't want to be near you, or I don't want to have sex with you, but then they are not able to say, because the conditioning in their childhood is such that they could not say no, that their boundaries were constantly compromised, that a lot was asked from them, that a lot was expected out of them, that they were under too much pressure. And that's where the body decides that this is it, I'm drawing my line. So even when I'm doing, you all know that I do a specific process called family constellation. And even when I'm working with diseases through the process of constellation, and I come across something like this, that what is the reason of your illness? In the sense that, what is your illness trying to say? What boundary is your illness trying to create? To whom the body is trying to say no, that you haven't been able to say no. And because you have not been able to lay down clear-cut boundaries, look at this line. If I can't have clear boundaries, at least I can have clear-cut symptoms. And it's a profound line. I mean, whenever I tell people who I'm working with through family constellation on diseases, and they discover something like this, where their body is trying to say no, their body is trying to create boundaries, that's when I tell them that, isn't it so that you are trying to say, or your body is trying to say, that if I cannot have clear-cut boundaries, at least I can have clear-cut symptoms. And that is a moment of great realization for them, that my illness exists as a result of me not being able to create boundaries, and somehow my illness is also working as a stabilizing agent. When I told you that two people may not want to come together, the husband may exhibiting it in the form of, let's say, a prostatitis, or the woman may exhibiting it in the form of vaginismus, the opposite of it is also true. Sometimes people say that, I'm glad that I have this illness. If I didn't have this illness, maybe I wouldn't have been in this relationship, or maybe I would have quit this relationship, or maybe I would have cheated on so and so, or maybe I would have been infidel. And I asked them that how do you validate that? How do you state that? And they say that, this illness not only um, keeps me in my body, but this illness also makes me realize that how much I am indebted to my spouse. Because if I didn't have this, I would have been free enough to move out and be anywhere. So sometimes it is also a stabilizing element. An illness can act as something that is not only laying down your boundaries, but also stabilizes something that you haven't stabilized within yourself, right? So maybe uh, this part of you who wants this illness as as a creator of this boundary, or as an element of this stabilization, was formed not today, but was formed many, many years back. As I said, that our early childhood conditioning to a lot of chronic stress, demands, expectations, performance, um, can definitely affect us in not having proper boundaries in life. And when we don't have proper boundaries, of course, we will have proper symptoms. So uh, that is where we are right here. I will take a moment. I will come back to the explanation, but I will take a moment to look at the questions, if we do have questions. Okay. So yeah, people have joined. Okay. I don't seem to have questions, but I do have some lovely comments, and people are definitely liking this live. And I request once again for to all of you, so that you can share this live, and more people can come ahead and join in. So um, moving on, what can we do about it now? Okay, so first of all, it is important to identify that what kind of boundary is my disease trying to lay down, and who is it or where is it that I truly want to say no, but I have not been able to say no. And then slowly and steadily, we begin the process of setting down our boundaries. We set down our boundaries by simply, without anger and without feeling victimized, not feeling like a perpetrator, but also not feeling like a victim. Without these two feelings, we begin to say no. There are a lot of exercises that I teach in my workshops where we focus mostly on healing the inner child, which which was under pressure, which was under severe expectation, which was under the expectation of performance. And when we begin to go back to those childhood experiences, we understand that as of today, we don't have to be in that capsule where we had to constantly please someone. We don't have to be in that capsule where we constantly have to be under the gaze of someone because something wrong might happen and we don't have a say of our own, which means that we also don't have an identity of our own. We have to say we have to do as we were told to do. Or we are constantly not under the gaze of that professor who wanted us to perform a certain way. We are no longer a part of that project where we needed to prove our point. We no longer are in front of those guests that mom or dad asked us to come in front and sing a poem or even dance. And we didn't want to do that. But we did that because, oh, if I don't do that, I'm a bad boy. Or if I don't do that, I'm a bad girl. And mom is not going to love me, or dad is not going to love me. Right? So am I that little boy or little girl anymore? I am not. So my pleasing or me saying yes to everything is not required. And these are things that we learn through exploring our childhood experiences, exploring our own traumas, exploring the lives of our parents also, that maybe even they could not have proper boundaries. You know, a mother who was constantly abused or dominated by her parents will not know what boundaries are, will have a very diminished sense of herself. Or let us say a father who never had parents around him, but was either an orphan or looked after by grandparents, wouldn't know where he is a child and where he is an adult, right? And that is, of course, going to percolate down. So, in many families, especially with grave illnesses, it is seen that people are unable to have boundaries because um, they are also huddled together. And they are huddled together because they want to ensure that we are all protected and safe. And who are the people who would want to be protected and safe? These are the people who, because of some trauma in the past, were not protected or safe. Maybe a parent died. Maybe, you know, the mother was under constant pressure by her mother. Maybe women were not allowed to have voices of their own. Maybe men were not allowed to live life of their own, in the sense that they had to marry whoever the family asked them to marry, and they had no sense of self or no sense of individual identity, right? So when we create our own individual identity, please remember it's a separation you are experiencing from your parents. And that separation can feel like withdrawal symptoms. So when we withdraw from uh, a drug, or withdraw from alcohol, or withdraw from an addictive substance, the kind of withdrawal symptoms we experience, we may feel similar withdrawal symptoms when we withdraw and we move forward having a personal individual identity of our own and not tied to the identity of our parents. And when we try to create that boundary within us, around us, by telling that mom, dad, uncle, auntie, brother, sister, I love you, but this is where I become me, I become I. And that I becoming I is creating boundary. And when that does not happen, that is when the body takes a toll. And that creation of the I becoming I around the circle will make you feel guilty. And that's your withdrawal symptom. And you may want to constantly go back and apologize and please once again, or be under the authority of someone once again, or want to perform and validate your existence, or would want approval from someone. So these are withdrawal symptoms when you start creating that, but these are also everyday practice. Of course, in my workshop, I teach these everyday practices, and so that you can include it in your own life and you start practicing them. But remember that creation of boundary and 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 having clear-cut ability to say no is something that you will have to practice. It's not going to come in a day's time. Okay, so I'll just go ahead because there are more comments. Okay. There were queries about fibromyalgia and asthma. Okay. So fibromyalgia is again another chronic illness that I have seen developing over a period of time. Is again a lot of anger stored in the body and the inability to express that anger. And in 10 out of 10 cases, people are unable to express that anger because they feel guilty that I might hurt someone, or so let me have the anger within me, and that causes inflammation in the body. So that anger is trying to say that okay, this is it, this is the end, I want to lay down my boundary here. But then again, people are unable to do it because well, they feel guilty of doing it, right? So that's again about boundary. Asthma, I usually ask this question to people who have asthma is, um, who is sitting on your chest? I literally ask, who is sitting on your chest? Because if someone is sitting on my chest, can I move? Can I have a say of my own? Can I have a voice of my own? My throat is literally strangled. Can I speak? I can't, right? So I ask them, who is sitting on your chest? Because it's a major, major, major case of no boundary, or transgression. So if we say yes to whatever our body is saying, this is a question. So if we say yes to whatever our body is saying no to, does the pain start to fade away? Is resistance causing pain? Is acceptance the solution? Yes. Initially, you will feel guilty. Initially, you will want to go back and please once again. Initially, you will go back and seek for approval once again. But then as you practice more and more and your inner landscape changes, and by the way, people around you are going to find it very difficult to adjust to your new behavior of saying no. But then you will have to keep at it, because if you do it 2 days and if you don't do it on the third day, they will feel that, oh, this guy is like, we can't understand this guy. I mean, one day he says no and one day he says yes. What's happening? So you have to be also constant with your own inner resolve to say no or creating boundaries. Yeah, so we have Karine, who herself is a naturopath and practitioner, and she works with autoimmune diseases a lot, and she is confirming here that I definitely confirm that I never seen anyone in my practice with autoimmune not having issues with boundaries, and that's true. Okay, the workshop on setting boundaries is just amazing. It was a big shift, big shift for me. I would definitely recommend this workshop to everyone. Thank you, Kareem. Thanks a lot. So, so Shruti reiterates that saying no without the feeling of victim or perpetrator is definitely the answer. It is so difficult being so evidently clear. So we can rationalize it. And you are right, Shruti, that we can rationalize that, oh, I can't be the victim. I can't be the perpetrator when I say no. But to internalize it and to say it from within without actually feeling like a victim is really a process. And it takes a lot of work, and it does take a lot of training, I would say. And that's what we do in our trainings. So I think we have a similar question. What if someone knows all the theory but still struggles with breaking away from all these people? Divorces aren't easy in India. Children are responsibility forever. How does one break away from all of this? So that's the reason why we are delivering a talk and making people aware. But yes, it does require a lot of process. For starters, one can begin to read more about boundaries. As I mentioned about Dr. Gabermate, who has written a book called When the Body Says No. So for you, maybe you could start with that book. And then of course, I'll be talking about the upcoming workshops that we have on diseases and ailments and chronic illness. And you can, of course, come and attend those workshops with us. So Karine says, I realized that it really started from within, has almost nothing to do with who is around. Yes, that's true. That's true. Sorry. Hello, Gaurav. Anupama says, and hello. So thank you for joining in. I'm really thankful you took the time to come in and join. Yeah, again, a skin condition due to virus, for example, Chandana says, or wart. So I would say that, well, it again comes down to your immune system, which does not work in isolation. Your immune system works in tandem and in concurrence with your environment. So there is something in your environment which is making your immune system more and more susceptible. There is a proclivity of the immune system to attract or to not able to work it out with an infection. right? So because it's not going to happen to everyone, it happens to a few people. And when we study their immune system, we get to know that, well, the immune system is compromised at some level. Is this one of the reasons for cancer? What causes obesity? Yes. It is one of the reasons of cancer. It is definitely one of the reasons of cancer. And we discuss cancer in detail in our upcoming workshops, which I will be talking about. Similarly, with obesity also, people are actually trying to create boundary with obesity because, well, it is a boundary at the end of the day. They are insulating. There is something unsafe outside that they are trying to protect from entering. And that's how the boundary is being created. So obesity is the most visual, clear-cut answer to the body wanting to say no. If we see condition like asthma across generation, does it mean that someone has picked up not keeping boundaries from the family system? So this is a complex question. And thank you, Vishruti. This is a question from Family Constellation. What she means in this question is, in conditions like asthma, if someone has not been able to maintain boundaries, has that person learned it from someone as a result of trauma in the family? And that's possible that they may have learned it from someone. As I said in the beginning, that if there is someone in the family, if let's say a mother in the family who is constantly abused and doesn't have a sense of her own identity, along with that, let's say she has lost her parents, so she does not know where she ends and where the other world starts, because the nourishment and the love also did not come through. Let's say a man who is constantly under pressure by the family to perform and take care of the other children because he happens to be the eldest child. How is he going to develop his own individual boundary? And of course, if he does not develop, if she does not develop, obviously the child emerging out of these two people, or even one of them, is not going to have, right? That is why even in addiction, we see there is no clear-cut boundary, because people simply give in. And people simply give in because they are trying to have more and more and more of that, whatever makes them feel good. And there is no boundary, there is no understanding of, or there is no non-intellectual. Intellectual understanding is there. I know that alcohol might be bad for me, but there is no non-intellectual bodily understanding that, okay, this is where it ends. And so not having boundaries could also be a result of intergenerational or transgenerational trauma, and that may have developed over a long period of time. So we have this upcoming workshop called Psychogenomics of Disease from 3rd December to 6th December. Okay, so details of the workshop can be found in our in this group itself, and you have the details here as well. Workshop details, dates 3rd December to 6th December, timings 5 p.m. to 8 p.m. Registrations are open right now. You can call up 931-579-9766 in order to register yourself for this course. If you want to know more about diseases, chronic illness, how trauma impacts chronic illness, and how it leads to people developing not just autoimmune diseases, but different kinds of physical and mental ailments, and how to actually move out of it. So we will be using methods like Gestalt therapy, performance work, expressive arts therapy, regression therapy, somatic psychotherapy, and many more, in order to help people with these tools that they can use, where they can not just create boundaries, but live a more individual health-centric life, where they can begin to look at their own bodies as their own, and not it as an extension of something external, or not having a sense of their own identity. So the tools that we will be delivering in this workshop will definitely help you to live a healthier version of yourself, and also maybe work with people. If you're a therapist, if you're a trainer, all the more important, because it will help you to deal with people who are going through chronic illness, and people who may have a history of not just trauma, but inability to lay down boundary, or needing some stability in their relationship, which they're manifesting through their illness or disease. Now comes the surprise element. I said that there's a surprise for all of you. And the surprise is, I have been talking about family constellations a lot. We also have a course on family constellation, a 10-month course coming up next year in February 2021. But on 7th of November, note down the dates, please. 7th of November, 2020, 5 p.m. to 6 p.m., I'm going to deliver a masterclass, okay? So we will be talking about family constellations there, and how constellations play a role in helping to lay down boundaries, in helping for you to develop your own individual identity, your fate, your time, your energy, so that you can live a more fulfilled life, so that you don't end up carrying someone else's burden, someone else's pressure, someone else's fate, and basically help yourself to live a more conscious life. So we have this masterclass coming up 7th of November. And right after this live today, I will be sharing the link for registration, which happens to be a Google form, which you need to fill up. And then, of course, the link to the masterclass will be sent to you. Okay, so you will find the link on this group, Workshops by Dr. Gaurav Dekka and Cognitive Healers Academy, in this group. You will also find the link on my profile if you are my friend in my Facebook profile. You will also find it on my page, Dr. Gaurav Dekka. If you haven't liked it so far, go ahead and like it so that you get the updates. Okay, so in all of these 3 places, I will make the link to registration available, and I would like all of you to come over and attend this masterclass. So it's an open invitation to all of you, so that you can learn further and learn more about the fundamentals of family constellation and how to lay down boundaries there. So thank you once again. Thanks a lot. I'll just have a look once again if, yeah, so Garima has also written down her number, 931-579-9766. So you can get in touch with that number in order to, mind you, register for the psychogenomics workshop, this one. And of course, 7th of November is closer, and that's something that you can come over and do this class with me. Okay, so I look forward to having all of you attending the 7th of November class on family constellation, and I would look forward to more and more registrations. And with that, we will end today's live. I think it was a big, detailed, huge live. So thank you so much. I'm going to stop sharing and look for the comments. So Karine says, thank you, Gaurav. Thank you, Karine. Jasdeep says, thanks for the insightful live session. Gaurav, love and gratitude. Thank you, love and gratitude to you too. And Vishruti says, thank you. So thanks a lot once again, all of you, for joining this live. I will make the recording available for people who could not be there, and of course for people who may want to register for our family constellation masterclass on the 7th of November, as well as the workshop called Psychogenomics of Disease, which is happening from 3rd of December to 6th of December. Thank you so much. Bye-bye.